Hey guys, welcome back to Dr. Battisi. I'm your dentist, Dr. Jasmine. मेडिकल टूरिज्म, डेंटल टूरिज्म, ये ऐसे वर्ड्स हैं जो हम बहुत बार सुनते हैं. So what exactly it is and how it is an option to grow our practice? No matter if it's a clinic, no matter if it's in hospital, it's a charitable clinic or if it's a private. Medical tourism is basically, guys, that people are coming from their own country, from abroad to your country. Here we are talking about India. So people are coming for to getting treated because of the right treatment here, and with that they also get the chance to explore the country they are traveling to. So dental tourism is a part of medical tourism. Dental tourism is also known as dental vacations or dental holidays in Europe. It's basically 20 to 25 billion dollar business industry. And when I say it's business industry, it's definitely a business, guys. There is no problem in terming this as business, because business is at the end beneficial for everyone. It should be a good thing for the patient, a good thing for the doctor, for the dentist, and if it's providing value to everybody without including corruption and everything, then business is good. Business is something that we all must do and be atmanirbhar, as it's the need of the hour, especially for India. Dental tourism is like a business which can help many of us. It's just an option which might and may not be the best for you, but is definitely an option which you can go ahead or think of. This is something that most of the clinics are also practicing. So guys, dental tourism is like people are getting treatment here done in India for variety of reasons that we will be discussing. They come from abroad countries to India to get the treatment done. The main reason for their coming to India is treatment, and with that they explore India. It's not just we have a clinic and the patient is entering, some abroad patient is entering and we are treating them. That is not dental tourism. Dental tourism is when patient specifically aiming for a dental treatment comes to India, and of course with that he tours and he explores our beautiful country. So why patients will be coming? See guys, there are various reasons people don't have dental insurance abroad. Some of them have, some of them don't have. For that, secondly, very less treatment charges and medication cost. Treatment charges in comparison, I don't have to say this, but it's very less in terms of abroad, because abroad the rental charges, the infrastructure charges, their estate charges, real estate charges are very high. Because of that, they have to keep the treatment charges also high, leading to a lot of charges which the patient can eventually not afford. In India, the ratio is really less, and the medication cost in India is quite less too. People are accepting things like, guys, naturopathy, Ayurveda, acupuncture, yoga. So this is wellness tourism. Because of this, India is the hub of Ayurveda. This attracts a lot of tourists and abroad people. Medical tourism has a disadvantage that mainly the patient is having some heart surgery or some fracture getting treated or some plastic surgery. So he's confined to the hospital for most of his time. With dental tourism, we have a benefit that if a tourist visa is for 6 months or to 1 year, then the dental treatment is easily done in 1 day, 2 day. Maybe if you're getting an implant, it can be done in the 6 months also. It's 1 day procedure. Maybe you're getting a smile makeover, one sitting RCT, dentures, aligners, veneers, anything. It's just 1 day. Scaling, cleanup, anything you want to get it done. It's hardly a issue of time. So this is something that is really beneficial in terms of dental tourism. In India, Kerala, Goa, Jaipur are the main hubs of dental tourism. People are really attracted to these states, but to be very frank, if dental tourism is planned and executed smartly and correctly, guys, I don't think there is any state which is less capable of dental tourism than India. Every state in India is equally capable. It has so many things to explore. Even I haven't explored India fully. I haven't been to every state. Every state has the equal potential. Yes, some has more. India is truly a boom for dental tourism. People come to India like by traveling, while exploring on business trips. Due to currency differences, the treatment here is quite affordable for the patients and abroad. Dental tourism for dentists is we can develop better practices and better dental tourism business. Now what happens is if somebody in abroad is searching for dental tourism here in India, he has two options. Either he directly contacts the clinic or the dentist, or he comes in contact with the tour operators who will definitely take care of his dental treatment. So if I am a dentist sitting in India, I have also few options, like either I have a site available, either I have something online, because the patient there will be searching online. The patient comes to know about my clinic, he will come to me directly. Or I also contact tour operators, that if a patient from abroad comes in contact with them, the tour agency comes in contact with me. Or there are various companies such as which operates on medical and dental tourism. There are few things that you can do if you consider dental tourism a part of your clinic, and facility provision solution that you provide, because I don't like the word, guys, deals or packages, but instead solution, facilities and provision, so that and the patient doesn't want to know like what is the consultation charge, what is the x-ray charge, what is the treatment cost. He just wants to know the overall cost. Of course, if he asks for the specifics which he has the rights to, you can definitely tell them this is for this, this is for this, and this is for this. But overall he just wants to know that I want to get this done, tell me the charges. So that is something you can plan upon. You can have a good, easy, affordable, a great provision facility for him. You can have the language, make the communication easier, break the language barrier. If you have various branches of your dental clinic, and or if you have just one and it's doing too well, if you're a certain level, then you can have the translators in your who are associated with your dental clinic, have local numbers of your clinic in their countries. You can do that. This is one of the options. When a patient comes to your clinic or contacts you, we have an like visual or online consultation just to know what the patient expects. Then when he lands up, because he plans the trip according to our treatment, when he lands up, we fix and make it easier for him to travel. Maybe we arrange a cab for him, and we can also arrange an hotel for him. We can just give him an itinerary of the things, of the places that he can do or visit, which is near to the clinic and which is in and around the area he's visiting. Maybe it's Delhi, maybe it's Kerala, maybe it's Gujarat, maybe it's Rajasthan. Or so that way you can do. Take testimonials. Testimonials are the proof, the honest reviews, feedbacks of the patients, and you must have a record of them. Either record a 30-second video, or you can also ask them to write. Less waiting time, this is the priority. If patient is traveling across like Sat Samundar Par for you for getting a dental treatment done, make him a priority. Set aside one complete day for him, so that he feels like he made the right choice. You can also tie up with different dental clinics abroad. How you can do that? You can consult or ask your friends, your dental friends, dentist friends who are abroad. Many people do move abroad after doing a BDS in India, so you can contact them in various countries. So that way you can tie up with the clinics also. Advantage, the patients won't bargain, but that doesn't mean like if I'm getting a scaling done for 1,000 rupees, I can charge them 2,000. That 1,000 rupees won't matter to them, but that doesn't mean I go over the limit. I can't charge them 10,000 rupees, because then it will equal the amount they are saving while traveling. Then there is no faida of them to coming to India. So this is something that the patients won't bargain, I really hope. And but we should not do the extremes, because in that way we have heard many stories like the hotels, the 5-star hotels charge extremely high for two boiled eggs or maybe two bananas. So that is exactly, we can't just do overcharging them. Sterilization is the main thing, guys, and especially after this COVID thing. um we have to see that every country is different. People from Europe, USA will be expecting high quality treatment, and people from Africa maybe want an affordable treatment. But that doesn't mean we compromise on sterilization from for any of them. And also different, we are not selling a t-shirt, or we are not selling some product. We are selling our skills. We are treating them. We are firstly a doctor's business, and earning are a part of it. But we have to make sure that the patient is healthy, the patient is comfortable, the patient is painless, the patient is not afraid. So with this complete thing, we have to make sure that the treatment charges we provide is different for everybody. If scaling is 1,000 for one, it can be 1,200 for another. We have to look at various factors. We have to play it smartly. Even the products available in the market are of different range for different people. So accordingly, there is no fixed price on something, that this is something for someone, then that means this is something for other patients too. There are various complications that can happen. For example, if we did an extraction, the patient might get a dry socket, and by the time he gets a dry socket, because dry socket happens within like 3 to 5 days of the extraction, until that time he's in his own country. So the complications can be more expensive to treat for him in his country than the normal treatment that he got here. So we must be sure that whatever treatment we are providing him, it's like up to the mark. If we are in doubt, we can obviously consult our senior. We can contact the specialty doctors, dentists, but we should only do the treatments that we're really confident of. Second is the legal system differences, guys. Every country has different legal systems. So if a patient wants to sue a dentist here, so it would quite be difficult for him to manage both the legal systems of this country and of his own country. Thirdly, the infection protocol and the sterilization standards are different for country to country. It depends. So what can happen is, after COVID, although generally the basic treatment and the sterilization remains the same, but still the patient should not feel uncomfortable in getting a treatment here just because of sterilization. So we must follow all the basic protocols, and especially now more patients coming to India, guys. It's great for the GDP of India, it's great for the tourism industry of India, and it's great for the dental products, dental materials manufacturing Indian companies. Because if they have really a high scope in that, if they make products that are equally good like the abroad products or the products from different countries that we normally use, then India is like, the dental tourism is a boom in India. This is an option that can be adopted by the dentist if you want. This is an option which will boom. This is an option which will grow your own dental clinic, you as a dentist, and of course India. So guys, stay safe, take care. Jai Hind.